Now, the Pretoria High Court has revoked its earlier judgment on the placement of doctors in state hospitals. It now states that the Minister of Health should be afforded his day in court to defend the department's plans on where doctors work. In June of 2022, the High Court upheld an application by Trade Union Solidarity and 6 others challenging the constitutionality of the Certificate of Need provisions in the National Health Act. For more on this, we are now joined by the Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Doctor, thank you so much for joining us this evening. Now, Doctor, let's speak a little bit on this certificate of need that doctors and health facilities need to acquire before establishing or expanding on a practice. What are its requirements?
Good evening to you and to your viewers. Thank you so much for inviting me to your program. As you know, this was legislated in 2003, and the South African Medical Association has been at the forefront, raising issues around the certificate of need, because obviously there are many reasons that we advanced at that time. But it empowers the health Department of Health to impose conditions on the certificate, including the nature, the type, or the quantum of services that may be provided at a health establishment or agency, or even deployment of human resources, and the use of diagnostics and therapeutic equipment. So it's for example, it tries to fairly distribute human resource and other resources, to also far-flung areas or in the rural areas and other places. But what it fails to do, it then negates the fact that, already we've got establishments in place, both in private and public. For example, if you look at the province of the Eastern Cape, we've got 2 hospitals there. One is Mthatha General, and the other is Nelson Mandela Academic Hospital. They're in the same vicinity. In fact, they are separated by a fence. So what are you going to do with those institutions? Are you going to, just destroy one hospital and leave another? The other example is that in Durban, where you have St. Augustine's Hospital, and Tabeni Hospital, and also Makhod Hospital, they are in the same vicinity. So which one falls? How are you going to apply the certificate of need? I think that's a very important question that we have at the moment as the South African Medical Association. But the other thing is, it restricts freedom of economic activity as entrenched in the South African Constitution, and creates future economic uncertainties, when it comes to practitioners. And you can imagine in a family where there are 2 practitioners, family life could be unjustly disrupted. Especially if the male and the female, or the partners, if I may put it so, are really medical practitioners, or even if they are practicing different professions within the health sector. The other thing is, just imagine if we were to sell that practice, it will be devalued because it looks like the certificate of need is not transferable from one owner to the other. So that could be a huge problem when it comes to, the uncertainty of medical practitioners and the purchasing of those practices.
But Doc, the DDG for Health, Mr. Nicholas Crisp, argues that this is a common practice all over the world, and in fact this certificate already exists in South Africa for pharmacies.
Well, I think what is problematic is that even here in South Africa, if you were to use that, for example, would you take a practitioner and send that practitioner to a deep rural area where there is no water? Because if you are going to be sending practitioners on these areas, you must make sure that there is water, there are roads, there are other amenities. Children can go to school and everything else. But you can't be forcing practitioners to go into those areas that are neglected by government, and think that by putting warm medical bodies there, you are going to make life easier in terms of the healthcare sector. It can't work like that.
Now, the health minister promises rather to defend this in court. Have the various groups that have already taken this NHI bill to court, have you sat around the table with the Minister of Health, put in your submissions in terms of what you feel aggrieved about, and what have been the responses?
Well, like you have seen with the NHI bill, you make submissions, you make oral presentations, there is no response, not even a written response that comes back to the organization that makes a submission. So we thought that we are dealing with a listening government, but we have, in our experience, we have noted that we do not have a listening government. You just something that is discussed out there and a decision is made, in a rally environment, and then that is taken through, even if there are concerns that are raised by professionals that you want, to keep in the country.
Speaking about keeping those professionals in the country, I mean, the Trade Union Solidarity had conducted a research study, and they found that there will be an exodus of doctors should the NHI bill be put into, or rather be enacted into law. What's your thoughts on that?
Solidarity was putting it mildly when they said there will be, as if it's happening in the future. It is happening now. Professionals are leaving the country because of this uncertainty. Because when we ask questions on behalf of professionals, there is no clear response from government to say, this is the assurance that we're giving practitioners. There is nothing, there are no details with the NHI. So if Solidarity says they will be, we're saying they are already doing so. We've got names of people who are leaving the country, who have already left the country, to New Zealand, to Canada, to the UK, to all these other places. So I do believe that we've got to give details, in terms of this NHI, not that the sloganeering that we see all the time by politicians.
Most certainly. Doctor, thank you so much for your time this evening. It was quite valuable. That was Dr. Mvuyisi Mzukwa, the chairperson of the South African Medical Association.